This is Radio Bath.
Hello everyone, that was Long Hot Summer by Girls Aloud, and this is Cynthia Wiharja at the Brave Business Conversation. Today, we're going to have Dr. Ailsa Pringle at 12:30 talking to us about how to give the best care for your aging pets. She spent 4 years studying as a doctor of veterinary medicine at St. George's University in Grenada, West Indies. Gosh, UK weather, I'd go to Grenada. She then moved to finish her degree at Murdoch University in Perth, Australia. This girl really knows how to find sun. Anyway, after 5 years of studying abroad, Ailsa returned to the UK and settled in Bath, where she started working as a small animal general practitioner. 5 years in clinical practice led to the realization that she had a passion for pain management in geriatric patients and the use of acupuncture and laser therapy as a means to help alleviate and manage chronic pain conditions. This thought proliferated into a viable business idea, and Veterinary Pain Management Limited was then born. So now Ailsa continues to work alongside her first employer as well as other local practices to bring her services where her clients need them. So, she's outside of work. She can be found planning her next travel adventure, obviously Sunseeker, snuggling through her 3 beautiful cats, or attempting to train the family dog to be a doggy supermodel. Love it. So, a doctor with personality. You don't find that every day. Establishing a good work-life balance is one of the most influential reasons behind her wanting to start her own business, and Ailsa strongly believes that one cannot spend too long in the company of her pets. So, a really good topic for pet owners out there, but also a really good topic, if you think about it, for young people who want to start their own business. I mean, she hasn't really started this business for too long, so she can definitely be a role model for people who want to get out there and maybe do something different than their corporate job. Looking forward to talk to her.
Across Bath, Chippenham and Melksham, this is Radio Bath.
And this is Brave Business Conversation with Cynthia Wiharja, and I've got on the line Dr. Ailsa Pringle. Hey, Ailsa.
Hi.
Hey, good to have you on the show. How are you doing today?
Thanks for having me.
Yeah.
I'm great, thank you.
Great. So I'm looking forward to all the great tips. I mean, tell us a little bit about yourself, though, and how you got into being a vet.
I guess the story starts a really long time ago, almost probably before I can remember. But I always said I was going to be a vet, and I just followed that all the way through my schooling and on to uni. I don't really remember what the trigger was, but we've always had so many cats and dogs and pets of all types in the house, and I think that was just a strong influence, and I decided that I wanted to go out and help them further.
Exactly. Wow, that's really cool. Just follow your dreams. And I was just mentioning in your intro, you really know how to find sun. You've got education in Grenada, and then you went to Perth and everything. Was there a reason why you decided to get educated in all these different places, or were you just sick of UK weather?
I think with my more international upbringing, I didn't necessarily feel that I had to stay in the UK. And when I saw that you could attend university in the Caribbean, I kind of thought, heck yeah, let's give that a go, and just rolled with it. And wherever it took me, or whatever options I had, I went with the ones that I would get the most experience from, and I don't regret a single second.
Wow, that's cool. You were born in the UK, or were you born outside?
No, I was born in Hong Kong.
Oh, wow.
And then lived in Asia, so Hong Kong, Singapore, and then Hong Kong again, and then the UK in between, so quite international.
Quite international, and I'm sure you've seen pet care in all different types of situations there, different standards of pet care. What's really cool is that the international experience also. So pain management, there's lots of different vets. How did you get into pain management? Why did you choose to do that?
So I've obviously, when you qualify, you are a GP vet, normally working in small animal practice unless you specialise. So I was working for about 5 years at a practice, and throughout that time I realised I didn't want to be some super fantastic surgeon or any other specialist like that, but I was kind of getting this draw towards the old dogs, or the ones that weren't properly managed on their pain relief, or just needed a little bit more help. And from there, I kind of realized that you can do other things. You can kind of specialize in pain and how to manage it. And then as well, the addition of veterinary acupuncture, which I've learned, which I think is actually a fantastic adjunct to all of your normal medical therapies that we do.
Yeah, it's interesting, isn't it? It's. I always have a lot of respect for people who care for, older or geriatric care and everything, because it's nice and fun to play with cute little puppies and vaccinate them and everything like that. No offense to all the vets that do that, but for someone who really take the time to care for older pets, they're no longer cute. They're sometimes quite annoying, but they still do deserve the best care for the rest of their lives. What are some of the things we're going to talk about here? What are some key points do you think we need to pet owners need to know out there when they have older pets?
So a lot of it is going to be sort of lifestyle changes. So making sure that you're not treating your older pet like the young or adolescent dog that they once were, along with some weight management, and then some discussions on complementary and alternative therapies. And then obviously a difficult discussion about sort of end-of-life care and, what we can do to support them towards the end.
Wow. You could almost transition that into like people instead of pets, isn't it? Weight management, lifestyle. So whether you are a pet owner or you just want to be healthy in your older state, do listen in, and we'll be back with Dr. Ailsa Pringle from Veterinary Pain Management right after this. But I'm going to ask you to introduce this song. You requested this song. As you know, in Brave Business Conversation, we don't want to just hear about business. We want to get to know, the people behind the business. So I've asked Ailsa to, request some songs, and she picked Party in the USA by Miley Cyrus. Can you tell us a little bit about this and who this is for?
Thank you, Cynthia. This is basically a bit of a shout out to all of the colleagues I've worked with over the years. I know the past 10, 12 months have been really quite difficult for all of us. So I would love for you to put your stethoscopes down, your needles down, whatever you're doing. Have a good listen, have a good jig. And in particular to my favourite little oldie patients, Scrappy and Ember, who I can't wait to catch up with when I can go and visit them again. But everyone, let your hair down and just have some fun with it.
Let your hair down, let your fur down, and let's enjoy Party in the USA. Ailsa, welcome back.
Thank you.
Yeah, I'm excited about this. It's a good time for us to think about how we're caring for our older pets. What are some tips that you can give us? Where are we starting here?
I think I probably would like to start with weight management, which I would say is probably one of the biggest things that we deal with within a normal veterinary practice. And its impact on the life of your pet is actually massive. We know that dogs or slim dogs in a good lean body condition can live almost 2 years longer than dogs that are overweight.
Wow.
And I think that we need to be really promoting a healthy lifestyle and healthy body weight, because we obviously want our pets to live as long as possible. I mean, forever if we could. And I think that, starting young, definitely. I know that I deal with a lot of old patients, but starting young is the way to go, because if you can keep them skinny and lean, then as they get older, you're not having that pressure on the joints. You're not impacting their mobility as they are young, and you then are setting them up to live a much happier and healthier and longer life over the period of their lifespan.
Yeah, I mean, that makes sense, doesn't it? It's not about caring for them when they're in pain, but preventing the pain. I mean, how does weight relate to pain? I mean, why is weight so important? Why have you started with this topic instead of all the other topics?
I think it's very similar to sort of all the adverts that I'm sure you see on the television for humans as well. We know that excessive weight puts excessive pressure on your joints. So if you have good joints or bad joints, you don't really want to overload them. But imagine if you didn't have very good joints and then you're putting weight on top, you're then actually not going to want to walk or move in a way that is easy because of that. And secondarily, we know that fat cells themselves are what we would call pro-inflammatory, which in simple terms, when you are overweight and you have excessive fat in your body is almost in a constant state of stress, as it were. And that then predisposes you to certain cancers, to further joint inflammation and joint disease, as well as heart disease and diabetes. So I'm sure I sound almost like a human doctor because we are all animals at the end of the day, but weight and kind of a good, healthy, long life does go hand in hand, and I think that's, my main point there. Speak to your veterinary professionals. If they are telling you your animal is overweight, work with them to attempt to get the weight off, whether that's by diet and exercise, but making sure that you're doing it correctly and what's right for your pet. But keeping them skinny is probably one of the most important things, because it can save you money, essentially, in the long run, less on vet fees and less on other things. But also, like I say, it can just give them an extended life, which is what we want.
Wow, that's really good. And it probably keeps them looking better as well, isn't it? And because if the weight is preventing movement, it's funny when you say start young, because if the weight is preventing movement, let's say in their teenage years or whatever, they're not enjoying the younger part of their lives as well. It's not just the older days, isn't it?
Yeah, exactly. You kind of need to start as you mean to go on, and no vet will ever give you into trouble for having too skinny an animal. So aim for a nice, lean, slinky look, and that really will help you as your pet ages.
All right. Well, we've got another song request from you, Sweet But Psycho. I mean, is this like the typical profile of your patients or something? I mean, tell us a bit more and introduce the song for us.
It's possibly more of a reflection on myself, but we don't need to go into that. This is another one of the songs that I just like to kind of have a good dance around my house with my cats when I just need to pick me up. So it's as simple as that.
You've got 3 cats, is that right? Is that just a bit too much?
Yes, I do.
Okay.
Never enough.
Never enough. Well, good. This is a Sweet But Psycho by Ava Max.
Across Bath, Westbury and Warminster, this is Radio Bath.
And this is Brave Business Conversation with Cynthia Wiharja and Dr. Ailsa Pringle, founder of Vet Pain Management. Ailsa, you've been talking about weight management. Weight management as a way to care for your older pets, because the more they're healthy, weight-wise, there's nothing wrong with a skinny dog or cat for that matter. It's just when they are too much overweight, they're being restricted on their movement, they can't get healthy. So I think that's a great preventative care. Tell us more about what else we should be paying attention to.
So my next kind of bit will be really around lifestyle and kind of exercise adaptations that you need to be looking at as your pet ages. Obviously, when they're younger, they can cope on all different types of flooring. They'll love running around fields and everything like that. But as they get older, or potentially as they develop any joint problems or orthopedic issues, you do kind of need to adapt your home or the walks that you do and the lifestyle of your dog to suit their needs, essentially.
Okay, let's take a look at step by step. Your home, like you said, different kinds of flooring. What changes as a pet grows in the home?
So sometimes when their legs get a little bit weaker and they're not as well muscled as they once were, tile flooring or lino flooring can become quite slippy. Or even wooden flooring. And that slippiness actually kind of creates a bit of an insecurity with a dog, making them not want to walk on that certain type of flooring, or actually risking them not being able to get up after they've been laying down, and causing further injury if they are slipping. So providing, carpet runners along your floor, or even sort of doormats spread out so that you can create little walkways through your house, making it easy for your pets to walk on all different flooring to prevent injury, but also just provide them with a bit of support.
Oh, that makes sense, doesn't it? It doesn't have to be expensive. It's just a mat that you can put up. Yeah.
Exactly.
Yeah. What other lifestyle things should we pay attention to?
So lots of them, we obviously like to take our dogs on walks and in cars to get to nice walks. So generally, when they are getting a little bit older and they're not a little dog that you can pick up, getting them in and out of the car can actually be quite painful if we're allowing them to jump themselves. Or the act of lifting, if you are able, can be a bit uncomfortable for the dog and for yourself. So I would say one good thing to try and do, and again, starting younger so that it's not alien to them when you try and introduce it when they're older, is to think about having car ramps. So you can have really nice collapsible ramps that you can pop up to go into your boot so that your dog can easily walk in and out of your car without having to jump in and out, which then kind of puts impacted pressure on their joints, which may already be sore to begin with.
Yeah, that makes sense. And also I'm thinking of cats at this moment, because even at home, cats like to jump all over the place. But how do you keep cats from jumping?
That side of things is incredibly difficult, but providing almost like different heights for them to jump to. So if they have a favourite windowsill, for example, you can kind of have a little side table and then a lower footstool so that they can kind of go hopping from one to the other so they're not doing a giant leap. Similarly, if your couch is too high for them, you can kind of make little step stools, and there are ones that you can buy now so that they're cushioned and they can match your furnishings. But anything to prevent that impact, so providing little steps going up to their favourite area or their favourite sofa to try and, again, lessen that impact and keep them moving nicely.
Is there a certain age where you should start proactively doing this, or do you wait until you see signs of pain, or how do you start? When is old? When does old happen?
It is quite difficult because every animal is going to age differently. We tend to class animals as being geriatric as early as 7 or 8 years of age. But if you have an orthopedically inappropriate dog, i.e. they've had, unfortunately, their cruciate ligaments blow, or they've got early onset elbow arthritis and elbow dysplasia or hip dysplasia, then we know that actually they can have mobility issues and pain issues much younger in life. Similarly with cats, we know that about 80% of cats over the age of 12 actually have arthritis, but most of them are not actually being managed for it. So I would say start young, look for subtle signs, and if you have the ability to provide support from even an early age, it just means that you're setting your pet up to kind of cope with these strategies that you want to provide, steps, ramps, flooring and everything like that, as early as possible so that it doesn't confuse them when they actually do need them.
Yeah, that makes a lot of sense. And I want to get more tips from you when we get back after the news hour. But a lot of great tips there. Never really thought about ramps, especially, with these terrace homes around Bath. You have steps, you have stairs that pets like to go up and down to your room or something like that. That's also something perhaps you can think about. And it's not a lot of money to put a certain mats in. They've got carpet mats, rubber mats, things like that, and then putting steps in between. I like your tip about the cat thing because it's really hard to get cats to stop jumping, but if they have natural intermediate points where they can jump, if they are truly in pain, they'll probably find that yourself. So we'll be back with Ailsa Pringle after the news hour, and let's just enjoy a bit of updates and news after this.
Online, on your smart speaker, and on DAB Digital Radio. A voice for Bath. This is Radio Bath.
This is Brave Business Conversation, and we are here still with Dr. Ailsa Pringle talking about setting up a better environment, a better lifestyle for aging pets, especially when they're in their geriatric years, and how to get them to stay active by adjusting certain things in your home and in your lifestyle. So let's talk a little bit more about that. Ailsa, are you still with us?
Yes, I am.
Okay, you've got lots more tips. I know that. So let's continue talking about lifestyle, because that's something that we experience every day and we might take for granted.
Yeah, definitely. So I think my next bit is going to be about sort of how we exercise our dogs. And I know that loads of dogs out there are quite ball crazy. And ball throwing is probably one of the exercises that a lot of people do for their pets because it's an easy exercise. They throw the ball, they don't really need to go very far, and the dog's the one doing all the running. So for a simple walk, ball throwing is easy. But what I think a lot of people don't quite realize is the impact that ball throwing and the act of chasing and then stopping and sliding and grabbing the ball and then running all the way back again, what that impact has on their joints. I think a young, fit, healthy dog can cope with it quite nicely, but you do really need to be making adaptations as they get older or as they get more musculoskeletally, challenged by it. And so the changes that you can make with ball throwing, instead of throwing the ball, you can try and roll the ball so that the dog's not actually having to sprint as far but still gets the mental stimulation from it. You can try just having them carry the ball in their mouth for the walk. So if actually the ball is your dog's security blanket on a walk, then having them have the ball in their mouth might actually provide them with the same happiness as possibly chasing the ball would. And then another idea would be to try and play hide and seek with their ball or toy. So that they're almost doing more brain training to find the ball that they love so much, but not doing that high impact activity that can kind of jar their joints and make them feel quite uncomfortable. So it's making those slow and steady changes as your pet ages in order to provide kind of a changing impact or an improved impact on the joints, so that you're not just doing something that they historically love, but addressing the issues that might come out of high impact activity. You often find that when an older dog is doing ball throwing and playing, their joints or they become stiffer after those activities and kind of pay for it the afternoon after or the day after, and that's not really how we want to manage their pain.
Well, you also do acupuncture, don't you? I mean, what's the difference that acupuncture brings to older pets, and why do you suggest acupuncture instead of perhaps other forms of treatment?
So I wouldn't say that acupuncture is one that I would pick over conventional treatments, but I think that we all need to be trying to adopt a multimodal or all-round approach to management of pain or arthritic change. So as vets, we're very good because we have the ability to look at the drug side of things, and we can recommend anti-inflammatory pain relief and all different types of pain relief. But that really is only one aspect of management that we need to be looking at. You then have things like acupuncture, which I'm massively enjoying practicing at the minute, which can help relieve some of the tensions in the muscles that we can feel and see, which can impact how they move. But then also consider part of these complementary therapies, things such as hydrotherapy and physiotherapy. The people that practice hydrotherapy and physiotherapy are often highly trained in understanding how joints move, how that impacts the movement and mobility of your pet, and then bringing out the best of them by strengthening and using strengthening activities, by practicing passive range of motion, so essentially moving the joints, and then kind of massaging areas which may be causing trouble. So pain management isn't just thinking about drug therapy. Right. It is honestly massively multimodal and utilizing the people within your locality who have the skill set to help your aging pets.
Well, actually, you're going to talk more about that pain management, so I probably just jumped ahead on that one. But that's very interesting. So if I had a younger pet, right, should I even get them to start? Should I even get them to start exercising with ball throwing? Should I even make that a habit when they were young? Because if it's going to cause trouble, is it even something they should get into?
If you are able to very closely monitor your pet, and while you are doing the activity of ball throwing, you can understand if they're going to get any niggles or if they're not fully sound when they're walking and things like that, then it's not necessarily a bad activity to do. However, you need to be managing it, i.e. it is not a walk that is entirely consisted of ball throwing.
Right.
It is a couple of chucks of the ball, but then you are also going around and doing a normal walking activity. Or if you need more ball throwing in your life, I would suggest you actually have physiotherapists and hydrotherapists on hand so that they can find out whether or not your young dog is developing any niggles along its spine or with its joints that actually might be a secondary effect of the ball throwing. If you can work hand in hand with these other people, then what you are doing is not necessarily bad. I mean, if you think of agility dogs, they are weaving in and out of poles. They are going up and down ramps. They are going in and out of tunnels. They are doing high-impact activities, but they often have really handy trainers and physiotherapists and hydrotherapists that are there to help them at a maintenance level to keep their dog fit and healthy.
Yeah,
so I think
true.
that whatever activities you are choosing, you need to be very mindful of your dog and how they do that activity and making sure you're not ignoring any signs that they might have niggles that need addressing, and that obviously ball throwing is not a sole activity.
Yeah, exactly. And because when they're young, kind of like, do they understand pain? Do they understand that pain is not normal? They might just say, oh, yeah, that's just what happens. When you've got 4 legs, one of them's going to niggle. And they might think it's normal. So it's up to the owners really to manage that. We'll be back with Dr. Ailsa Pringle. Wait a second. You're going to introduce this one too. Getting Jiggy With It. Will Smith, 1998. What does this song mean to you? Because you requested it, so you get to present it.
I did request this one. This is a shout out to my favourite patient who I sadly had to put to sleep just before Christmas, Jiggy. She was the girl that got me into doing all of this. And although Getting Jiggy With It is an interesting song choice, it was the only song that I could find that had Jiggy in the title.
Yes, unless she named the dog Will or Smith, we're just gonna, we're just gonna use the Jiggy on it. Okay, well, let's enjoy it. This is dedicated to Jiggy. Wherever you are, Jiggy, we're still thinking of you. And we'll be back with Dr. Ailsa Pringle after this.
Locally made. This is Radio Bath.
That was Getting Jiggy With It by Will Smith. And we're still with Dr. Ailsa Pringle. We're talking about how to care for your aging pets. It's not the same as if you've got younger pets. We talked about weight management. We talked about lifestyle and different routines, different types of exercises. Ailsa, what else should we think about when let's say our pets are already in pain? What do we do?
I would say first things first, you probably need to go and see your regular vet so that they can do an assessment. I think it is always very important to be looking at doing sort of regular geriatric blood screenings just to look for any underlying conditions that may be there. Blood tests really tell us a lot, as well as sort of x-rays of joints if there are niggly parts of the body that we need to address. Once you have diagnoses or once pain is established coming from wherever it is on the body, it's then sort of attempting to manage them. Oftentimes, first line, we'll give some anti-inflammatory pain relief or some other forms of pain relief just to try and wind down some of the ouchiness that is there. But then looking sort of more long-term at the management, we need to be addressing movement. We need to be addressing, like I say before, weight management, and then also supporting the limbs, because we often find that hand in hand, pain goes with muscle wastage and reduction, and then impacts mobility that way. And the other therapies that we can do out there, and I'm a massive fan of physiotherapy and hydrotherapy, those are going to be the big bits that are going to help with those. They will help the movement of the joints. They they will help try and maintain muscle throughout the limbs and spine. And with those therapies on board, you're often finding that they provide in their own way pain reduction that a drug can't provide. So combining stretches and massaging and sort of the difference in movement while you're in an underwater treadmill, for example, are really going to help with increasing longevity, increasing comfort levels, and providing that well-rounded management to pain and age changes that I think are really important.
Interesting. Well, I'm going to toss you a very layman's question, right? Because there's many ways you can manage pain, right? You can just give them a drug. You can do acupuncture. You can do hydrotherapy. Can you just tell us in like really simple terms, what's the difference and when do we use what? Why can't we just use drugs for everything, for instance? I mean, I know it's a silly question, but just asking. And when do we know that we need acupuncture? And how is that different from hydrotherapy or massaging?
Yeah, so there's no set time for when these therapies are needed. Oftentimes, the sooner you can start, the better the dog gets used to it. A lot of what we're doing is manipulation. And again, with me practicing acupuncture, I am sticking needles into your pet. And it may or may not be something that they tolerate. So acupuncture may not be for every animal out there. But at the same time, everything that I try and do is non-painful. If they react or don't like it, I'm not going to tell them to sit down and shut up and put up with it. You know, I want to make sure that their experience is as good as possible. And if they don't tolerate the acupuncture, then fine. But oftentimes the acupuncture that I am doing is finding sort of trigger points or knots, as we would kind of call them, along muscle groups to try and ease the tension that's created by an abnormal movement. So when we want to go out and have a really nice deep tissue massage because we are so tense, the physio and the massage and the acupuncture are kind of helping those same niggles. In the same way that we could pop some paracetamol because we're a bit achy, sometimes that works, but sometimes we still need that massage. And so the same applies. It targets different areas of the body and different parts of the whole spectrum of movement in order to provide a well-rounded management of pain or creakiness or mobility issues. So they are all different, and I think you need to be in contact with your vet to see whether or not these therapies are appropriate in order to be seen by a physio, a hydro, or an acupuncture therapist. You need veterinary referral, so your primary vet will make the arrangements and set you up with the appointments so that you can carry on with those therapies. But it has to be at the blessing of your vet. We all need to be working together.
Across Bath, Chippenham and Melksham, this is Radio Bath.
We've been talking about how to give the best care for your aging pets, and we talked about weight management, lifestyle. We talked about different kinds of care when they are in pain, from acupuncture to hydrotherapy, physiotherapy. You know, it's almost feeling really nice to be a pet. You know, if you've got a great owner, it's really nice to be a pet, you know. But, you know, there comes a time when your older pets perhaps need to be put to sleep, or we need to say goodbye. And, you know, the last part of our conversation with Ailsa is about that, isn't it? You know, tell us a bit about your experience of how do you make that decision?
Yeah. So to me, the end of life discussion is probably one that people shy away from. And I just want to encourage people to try and keep the communication open between themselves as pet owners and their vets and their other therapists, because it is not something that is a sudden decision unless your pet gets acutely ill. But it is something that we really do want people to bear in mind. A lot of what we base end-of-life decisions on is a quality of life scale. And that very much is a sliding scale. So, you know, good days versus bad days. Make yourself a little diary chart and put a smiley face when it was a good day and a sad face when it was a bad day. And when the bad starts outweighing the good, that then kind of gives you a bit of a sign that things might be sliding down that scale. I would also like to mention that the quality of life scale is your quality of life as a pet owner, as well as your pet's quality of life. I think a lot of a lot of owners just look at their pets, but I want to make sure that you're also looking at yourself and how things are impacting you, because no one ever wants to resent their pet. No one ever wants to feel helpless about looking after their pet. So I think you have to be very conscious about all of those things and keeping clear communication between you and your vet, or even just friends and family, to make sure that when the time comes, you are making the right decision for both you and your animal.
So when you get to that palliative care moment, what changes? Tell us more about how things usually go and what you need to adapt to.
Yeah. So a lot of the time, an owner needs to be looking for their own negative indicators, and every animal is going to be different. If you have an absolute food fiend of a pet, then when they start going off their food, that might be one of the negative indicators for you there. But say if your pet's never been fussed about food, then that isn't one you're going to be looking at. But similarly, if your animal doesn't like being petted when they once did, that's not a very good sign. Or if they can't get up on their own, or even if they just lose their sparkle. All of these little things have to be things that you've got in your mind as being negative indicators. And when they start to add up, that's when you need to be thinking about making that difficult decision.
Right. So what are some experience you had when people make that difficult decision? Do you automatically just agree and then just say, right, okay, or do you try to see if there's any other things that they could do to prolong the life?
So definitely, I tend to do sort of almost like a mini counselling session over the phone, where we discuss what their pet is currently on medication-wise, how their pet is on a day-to-day basis, and then what things we can do to make improvements if there are some to be made. Sometimes there is nothing more that we can do, and it does turn sort of more palliative and supportive, but it is not kind of making a decision because someone thinks it needs to be done, but it's discussing and deciding kind of between everyone that is the right decision, and everything has been done specifically, for that pet, and at the end of the day, we don't want them suffering, and if that is creeping in, then making that difficult decision to put them to sleep is more than likely the right thing to do.
Yeah. Well, I want to turn the topic a little bit, just kind of go off topic a bit, because I've heard that you're very good at these end-of-life decisions, this end-of-life conversations, both on you have a good mix of counseling, the people side of things, the owners, as well as doing the logical thing, the right thing from a medical perspective, being professional about it. If you were to give advice to a junior vet, for instance, someone who's just starting out, wanting to learn more, what are some tips that you would give to vets about how to handle owners and pets in the end-of-life treatment or conversation, rather?
Yeah, for me, the most important thing I've learned by being a vet is actually how to communicate. Doing all the fancy surgeries and knowing about all the fancy medicines and everything like that is important, because that is one aspect of what we do that we need to know about. But I think actually building relationships with your clients, listening to them, giving them the time that they need, and reading the situation as it is, and treating every owner and family and every pet as an individual, because there is no one-size-fits-all. But if you can get your own communication skills down pat, and you know the things to say and you know the things to ask, and you understand situations deeply, I then think that will make you a better vet, because actually it's not just about the medicine and the things that, specifically to do with that animal and all of that. It is the situation as a whole, and it's the family life as a whole. And I think for me, the number one thing that I have learned, and the one thing that I really strive to be good at, is reading my clients and my pets and defining my communication style as it is to make sure that we are doing right by them.
Very good. And it's been great having you on the show. There were some last tips, one or two last tips that you'd like to give pet owners with aging pets. What would it be?
I think number one, keep the weight off. Work really hard with that. That has to be my number one, and that's an easy one that doesn't cost you any money so long as you start early.
Actually, it saves you money, doesn't it?
Exactly. It can potentially save you a lot of money. And then, build relationships with your vets and your other complementary therapists, because it's not just you and your animal. It's making sure that you've got everyone within their life doing what's right by them. So build relationships, communicate, and keep them skinny.
Oh, that's great. That's great. You've got a world of knowledge, international experience, and a very caring heart for pets and owners. It's been lovely having you on the show. Good luck with everything you're going to do with pain management. And we look forward to hearing more of you in different types of platforms. Thank you very much, Ailsa.
Across Bath, Chippenham, and Melksham, this is Radio Bath.